is Jessica, and I'll be doing a head-to-toe assessment on my patient here. His name is Christian, and this is my first time meeting him. So, hi Christian, my name is Jessica, and I will be your nurse today doing your head-to-toe assessment. Are you okay with that?
Yes.
Okay, perfect. So first I will take your ID, and can you state your name?
Christian Simonton?
And do you know where you are?
Yes, in the hospital.
Do you know what day it is?
November 22nd.
All right. So he is alert and oriented to person, place, and time. Do you have any pain at the moment, sir?
A little pressure, sinus pressure.
Sinus pressure?
Yeah.
Like a slight headache, would you say?
Slight headache, yes, for sure.
Okay. And so of course I would assess that. But I will ask the patient some questions first. But before that, I would provide privacy and perform hand hygiene, and then move forward. So I have his consent and I can move forward now. So I'll start with some questions. So your sinus pressure brings you in today?
Mm-hmm. Yes.
Okay. So when did you start to notice this sinus pressure come on?
The day before yesterday.
The day before yesterday, okay. And have you taken any over-the-counter medicine for it?
Yes, some allergy medicine and also like flu medicine, like NyQuil and DayQuil.
Have you noticed any relief from the medicine?
Slightly, but not too much. That's why I'm here today.
Okay, and we'll get you feeling all better. So can you tell me a little bit about your health history? Do you have any current illnesses at the moment besides your sinus congestion?
No current illnesses and nothing in my past that would be significant to this.
Okay, so no surgeries?
No surgeries.
No accidents?
No accidents.
Okay. And so what about your childhood? Did you have any type of accidents as a child or sicknesses?
No, nothing major, no.
Okay, good. Did you have any birth issues that you know of?
No.
Okay. All right. So what would you rate your pain, if you will, from a scale from 0 to 10 today?
A 3.
A 3. Okay. So we'll try to get that below a 3, of course, before we dismiss our patient today. So Mr. Simonton, do you like to be called Mr. Simonton, or is Christian okay?
That's fine. Mr. Simonton's okay.
Okay, so Mr. Simonton, what do you do for a living?
I'm a process operator.
Does this involve like heavy lifting or anything like that?
A little bit of heavy lifting and on my feet all day, and it's pretty physically demanding.
Okay. So would you say that you are stressed on your everyday job?
Yes, for sure.
Okay. All right. And how do you cope with your stress?
Working out and also relaxing when I'm home.
Okay. All right. And do you have any allergies?
No, not that I can think of.
No allergies. Okay. All right. I'm trying to think of, the next question I need to ask you. What about your education? How far in education did you go?
An associate's degree.
And are you happy with that?
Mm-hmm.
Okay. Are you spiritual?
No, not quite. Not really.
Okay. And do you have, relationships in your life that are people that you can depend on?
Mm-hmm. Yes, I sure do. My family is very close to me.
Okay. And that's good to have. All right. So, let's see. I will go to my note card now for a second. All right, and immunizations. Do you know if those are up to date?
Yes, they are.
Okay. All right, so I have pretty much a good, base of get to knowing my patient to begin the assessment. So that's now what I will do is begin the assessment now. I would don gloves. So, Mr. Simonton, one other question. Beside the allergy medication that you're taking, or I'm sorry, not the allergy, but the sinus medication that you're taking, do you take any other type forms of medication?
No, just vitamins over the counter. That's it.
Okay. All right. And so I will begin. I'm going to, of course, start from the head and work my way down. So first I would inspect his head. Have you had any type of, I know you said you didn't have any accidents or surgeries. Have you had any type of head injuries?
No, I have not.
All right. So I will inspect his head and note anything that I see as far as abnormalities. And then I'm going to palpate his head. All right, so no contusions noted, and no masses or anything like that. Okay, and now I will actually feel your tympanic membranes here. Sorry, your tympanic arteries. Okay, they are equal and 2+ bounding. Okay. All right. So now I will test cranial nerve number 7. I will have ask the patient to close his eyes tightly and open. Will you smile for me and frown? Okay, and can you puff your cheeks out? Okay, so that cranial nerve number 7 is intact. All right, next I'm going to go ahead and actually palpate his sinuses since I have my gloves on and I'll be touching his around his head. So just let me know, sir, if you have any type of tenderness. I'm sure you might with your current situation.
A little bit right there. Yes.
Right here?
Yes.
Okay. All right. Okay, so he did say that he noted a little bit of tenderness in his sinus area. So we'll make sure that we get him the medication he needs to start to feel better and have some congestion relief. Next, I will test cranial nerve number 5, and I will feel his masseter muscles here in his cheeks. First, clench your teeth for me. All right, and they are both hard like they should be. And then I will fill up to his tympanic artery right here and in between, and then I would ask the patient to move his jaw, and I would note any type of clicking, and I do feel the clicking there. Now I would ask the patient to open his mouth with resistance, and he does that with ease. And was that painful, sir?
No.
Okay. All right. Now I'm going to move forward to the patient's eyes. And so I'm going to go ahead and take these gloves off, perform hand hygiene, and return to my patient. All right. So I do have my pen light here to perform this. I have my hands clean. I'm going to inspect his eyes. And then I'm going to look at the whites of his eyes, make sure there's a white, not red. I'm going to note any type of infection that I see or any inflammatory areas. And then I'm going to pull down his lower eyelids and look at his conjunctiva. They are pink and moist. Okay. All right, good. Look straight forward for me, sir. Okay. All right, so let's see. I don't have a ophthalmoscope, but I will pretend that I do with my otoscope. And this is what I'll do is at an angle, I will look into the patient's eyes with my light. Okay, and then I would do the other side. Okay. All right. from there, let's see, get my pen light. Okay, I would ask the patient to look at me. I would, give me 1 second. Okay, gotta make sure that was still on. So from there, I would ask the patient to, right here, I'm checking for nystagmus, the moving of the eye in a really fast motion. So I'd ask the patient to look at the top of the pen light and follow it in the direction within range. So please follow the top, sir. Okay, good. So he had no issue with that. Next, I'm going to test for, I lost that word, I think it's stribic, I can't think of the word, I'm so sorry. But I do know what I'm going to do. I'm going to have the patient stare off. Okay? And then I'm going to come at the patient with my pen light, and I'm going to check for, since this patient is staring off, his pupils will dilate. I'm going to shine a light into one of his eyes, and both pupils should constrict at the same time. Alright. And I'm going to do it from afar because this pen light is pretty bright. Okay. Both pupils constricted, and then I'll come to the other side and do the same thing. Give his eyes time to dilate. Okay, and then bright light. Okay, so they both constricted. All right, my next test is I'm going to have him look at the top of the pen light and then follow it inwards while I move it towards his nose. Okay, and what I'm looking for there is evenness. I don't want one lagging behind the other. Okay, so from there, I would note, if his pupils are equal, round, and reactive to light and accommodation, in which they are. Okay, I will then move over to his nose. Of course, I'm going to inspect first, and then I'll palpate his nose. Make sure my hands are clean, of course, and then I'll palpate his nose, noting any abnormalities. Did that hurt? Was that painful?
No, it was not.
Okay. So then I would ask the patient to tilt his head back, and I'm going to look inside his nose for any type of drainage that I note, any redness, inflamed, deviated septum, anything like that. So, okay, it is pink and moist in there, and I don't see any abnormalities. Okay, you may lower your face. So next I'm going to test for patent nares, both sides. I would ask the patient to take one finger, cover one nostril, and breathe in and out from the other uncovered nostril. If you will, do that. Okay, and the other side. Okay, so, with his current situation and his sinus congestion and cold, I did notice that his left nare was not as patent as his right, so there is some drainage going on in there. Okay. All right, so I will now look at my note card a second time. Okay. So before moving on to either his ears or his mouth, I will ask the patient, seeing as though the patient has not seen this yet, I would ask the patient to close his eyes. Okay, and I'm going to wave this in front of his nose and ask him what he smells. What do you smell?
Smells like coffee.
Okay, and that is coffee, of course, and it is testing cranial nerve number 1 in his smell. Okay, so now I'm gonna move, just gonna go ahead and move forward with his ears. Okay, I'm gonna grab my otoscope. Okay, first, of course, I'm inspecting his ears for any type of unevenness or drainage that I note, any type of redness, swelling, anything like that. So I'm gonna look and turn your head this way, sir. Okay. Of course, I'm looking at the mastoid process behind as well, making sure that there's no, lesions, anything growing back there. All right. And so then next I'm gonna palpate. Does this hurt, sir?
No.
Okay. All right, and then I'm gonna palpate his mastoid process behind his ears. All right. And now I am going to look inside his ears and then look at his tympanic